Hi Trace, I'm Jane. I'm going to be your occupational therapist today.
Hi Jane.
I'm going to measure the joints in your hand
Okay.
and then do some testing on your hand muscles to test the strength of your muscles.
That'd be great.
Okay, so we'll start with your wrist. If you could bring your hand up like this. Great. And then flex your wrist down. Okay. And then bring your wrist back. Thank you. You can relax.
Okay.
And then with your hand flat on the ground,
Mhm.
if you could move your fingers outwards.
Okay.
Thank you.
Mhm.
And then inward, keeping your hand flat on the table. Okay, thank you. Okay, now if I could have you make a fist, but keep your fingers on the outside of your hand. That would be great. And I'm going to measure all of them, so if you could just
Mhm.
stay in that position. Thank you, you can relax. Okay, now I'm going to take the measurements of these joints, so if you could just put your hand up like that. Thank you. Okay, and lastly, I'm going to measure these joints right here. Lastly, on this hand, that is. Or on the fingers, I should say. Okay, thank you. Alright, if you could put your hand flat on the table,
Okay.
we'll just do a functional screening.
Okay.
I'm going to have you, with the tip of your finger, come up and touch the measuring stick and then slide down to touch the palm of your hand.
Okay.
Yes, great. And then with your second finger, touch it, slide down, and your third finger, and your fourth finger. Great, thank you.
I'm glad that went well.
Yeah, you did a great job. Okay, I'm going to take some measurements on your thumb.
Okay.
So, let's see, your palmar abduction. So if you put your hand flat on the table and then point your thumb straight up to the ceiling, and then I'm going to have you rotate, keep your thumb in that position, but rotate your thumb or your arm. Thank you. Okay, thank you.
Mhm.
And then put your hand flat on the table and move your thumb out as far as possible. Thank you, you can relax. Okay, I'm going to measure this joint in your hand. So if you could try to touch your thumb to the base of your pinky. Okay, and then this joint right here.
Okay.
Okay, thank you. You can relax. Okay, and then could you please touch your thumb to each of your fingertips? Great. Thank you so much, Trace.
Great.
Trace, we're going to test the muscles that move your hand to see their strength. So if I could have you put your palm up and then lift your fingers to the sky, bending your wrist. So bend your wrist up, perfect. And then kind of angle your fingers inwards. That's great. Okay, I'm going to apply some pressure, so
Okay.
stay there and don't let me move you. And then move your fingers out. And I'm going to slide my fingers in here. So I'm going to apply some pressure, so stay there and don't let me move you. Thank you.
Great.
Bring your hand up in kind of a claw shape. I'm going to apply some pressure to these first two fingers, so stay there and don't let me move you. Okay, and the same thing on this side. Stay there and don't let me move you. Great, thank you. Trace, could you move your elbow back and then lean forward? And then bring your hand up again in this claw shape. Okay, I'm going to apply some pressure, so stay there and don't let me move you. Thank you. These are some examples of gravity-eliminated manual muscle testing for the wrist muscles. So Trace, could you put your arm on the side and bend your wrist forward? Okay, stay there and don't let me move you. Again, stay there and don't let me move you. Okay, now bring your wrist back. Okay, stay there and don't let me move you. And again, stay there and don't let me move you. Okay, then bring your elbow back and bend forward with your wrist still on the side. Stay there and don't let me move you. Now we'll move on to your fingers. So I'm going to hold down some of your fingers and ask you to move. Okay, so if you could bend your first finger at that joint and stay there and don't let me move you. Thank you. Okay, bend your next finger. Okay, stay there and don't let me move you. Sorry, that's a little awkward. Okay. Again. Stay there and don't let me move you. Another. Stay there and don't let me move you. Okay, thank you. Okay, and again on your back. Okay. Can you bend your finger at that joint? Okay, stay there and don't let me move you. Okay. Wait. Okay. Stay there and don't let me move you. And again. Just try to bend at that joint. Okay, stay there and don't let me move you. Okay, again. Stay there and don't let me move you. Great, thank you.
Great.
Okay, and then I'm going to have you bend all of your fingers there. Okay, stay there and don't let me move you. Thank you. Bring your hand up in this claw shape and stay there and don't let me move you. Thank you.
Mm-hmm.
Okay, and then make this sign, and the same thing. Stay there and don't let me move you. And again. Thank you. Place your hand with your palm on the table and spread your fingers out. I'm going to push your fingers toward each other, so stay there and don't let me move you.
Okay.
Thank you.
Mm.
Okay, bring your hand up like this and keep your fingers together. I'm going to pull them, so stay there and don't let me move you. Thank you. You can relax. We'll test the muscles of your little finger now. So if you could put your palm up and then flex your little finger. Stay there and don't let me move you. Great. And then make the longhorn sign again. And stay there and don't let me move you. Okay, thank you. Your hand on the table. Actually, I'm going to record those measurements. Okay, put your hand on the table and move your little finger up. Okay, stay there and don't let me move you. And then if I could have you touch your thumb to your pinky finger, I'm going to apply some pressure, so stay there and don't let me move you. Thank you.
Mm-hmm.
Great. Trace, last we're going to test the muscles of your thumb.
Okay.
So I will have you bend your thumb at this joint. Stay there and don't let me move you. And bend this joint. Stay there and don't let me move you. And then, again, I'll apply pressure on this side, so stay there and don't let me move you. And stay there and don't let me move you. Great. You can relax, thank you. Okay, with your palm facing up, touch the base of the little finger. Okay, let me just slide my hand under here. Okay, stay there and don't let me move you. Then point your thumb up to the sky. Stay there and don't let me move you. And palm down and thumb extended, thumb out. Stay there and don't let me move you. Thank you. And then again, touch your thumb to your little finger. Stay there and don't let me move you. Thank you. Here are the results. It's the thumb. As you can see, the MP flexion is limited. And the manual muscle test, everything looks good. Trace, thank you so much for letting me take your measurements.
Yes, thank you. I appreciated it.
I just wanted to go over the results with you. Everything looked really good. You had good range of motion on your wrist and your hand, except for your MCP joint in your thumb, which is this joint right here. You had limited range of motion when you flex this. So that's something that we could work on. I also think that part of that is just the way your thumb is built. But that's something we could explore more. But everything else looked really great. You had full and functional range of motion in your hands. And then on your muscle tests, as you can see, you got 5 straight down. So everything looked really good, and I would not recommend occupational therapy for you at this time because everything looks really good. So thanks again. Good to meet you.
Thank you. I'm relieved to hear it. Thank you, Miss Jane.
Yep.